Good afternoon in a sunny Saturday day from United States. We are joined with a esteemed group of physicians from all over the globe, and mostly from United States to discuss the matter of COVID-19, its current state and its status as we speak. Um, my guests are involved clinicians who are in the frontliners here in the United States, in New Jersey, Dr. Manish Gugnani and Dr. Anes Suidi, and then also forefront of vitamin C and also integrative care of the COVID patients, and then approach of vitamin C and then other methodology will be explained by Dr. Thomas Levy, and my brother, Dr. Ibrahim Obuz, will join us from Turkey to share some of his experience in functional medicine approach that he and his colleagues have actually successfully tried during these hard times. We will be joining with Dr. Gugnani first because just before the meeting started, we were discussing how difficult was his experiences. He and his team has successfully treated patients in our hospital capital health systems. We are very grateful to their care. And Dr. Suidi was the head of the COVID suites and treatment group, hospitalist group. And they will start with, first of all, their experience. Dr. Gugnani, kindly let us know how we got caught, like were we ready to have all this influx of patients, and then how did you handle the initial abundance of patients? What kind of treatment modalities gradually evolved from your experiences, and then let us know your current status. Everybody is talking about the surge and then a new increased number of cases. Does this translate into increased number of hospitalizations? Go ahead, please. Ball is in your hand.
You need to unmute.
Unmute yourself, yeah.
All right, unmuted. All right, thank you, everybody. So, yes, we were heard about the COVID, when it started happening in China, then in Europe, and then we started seeing New York, and it was kind of unbelievable. And despite all this thing, we never expected that it would hit us like this. It was beyond belief, and how rapidly it came. I remember our first case in our hospital was around March 24th or 5th, and within we went from one patient, and in a matter of 10.
We lost you for a second.
To 91 patients total, inpatients in the hospital. Out of those 91 patients, we had around 28 to 30 ventilated patients that were managed in the ICU setting, and the rest were managed on the floors by the hospitalist group, by Dr. Suidi's group. Initially, when the patients were being admitted, we didn't really know how to treat them. Most of the data I was getting was from talking to people from Italy and my colleagues in New York. One of the things that inspired me we were actually one of the few places to started using steroids and anticoagulation even before the big centers. After I had read a whole thing from the Dr. Marek's protocol, and I was a strong believer of vitamin C, which I've used in sepsis for my patients, and I've seen the results. So we started the Marek protocol, not wholly, but part of it, including the vitamin C and the steroid aspect. And then we started seeing results. One of the things that led me to be a strong believer of early anticoagulation was when I was putting a line for dialyzing a patient. The blood in the vein was so thick, like a washing machine. It was not a clot, but it was just thick blood. And at that time, I realized that we're dealing with something more than so-called an infection. It was more of probably a vascular problem. And that's why we started doing early anticoagulation and higher dose prophylaxis and full dose earlier on, before the recommendations even came out. That's how basically we kind of like, and over time, as new data came out and new drugs we were allowed to use, we started using them. But I think the cornerstone of our management in that time was early steroids and anticoagulation, and good, and of course, good proning. We started doing proning early on, even on patients that were not intubated, just on the floors, and good basic critical care. That was all it needed in the ICU. One of the first things we did in the hospital was to isolate the floors. We had the COVID patients on certain floors, and they were managed by the same numbers and of same physicians, so as not to expose other physicians to COVID and prevent further spread. We also took out the tubings and the IV lines out of the rooms. We also took out the ventilator monitors out of the rooms to limit exposure to limit the personnel from getting exposed to COVID. And that's how basically we started doing that.
Do you see a current exponential increase of inpatient patients at this point, or how many patients do you have COVID patients, and how many of them in ventilator now?
Well, we have right now in the hospital where I am, we only have one patient on the ventilator, and I think we have 13 other patients, so a total of 14. We are starting to, we had seen a downward, we were down to as less as 3 patients, but in the last couple of weeks, we are starting to see a little bit uptick. But one of the things I've noticed is that the patients coming in are not as sick as they used to be. And I do not know, I don't really have an explanation for that right now.
We will ask all the panel speakers at the end, make an interpretation, or if anybody read any recent data about the change in the nature of this disease. And then probably Dr. Thomas Levy will have an answer to this, most senior researcher among us. So let's ask Dr. Soueidi now to share his COVID-19 patient experience from the floor of the, in terms of not so sick, but still sick COVID patient management. Dr. Soueidi, go ahead, please.
Good morning, everyone, and thank you, Dr. Obouz, for including me in this panel, this great panel. And as Dr. Ghugnani said, we knew that the virus is coming. We knew that we were going to be hit, but we did not expect the fast growth of cases that happened in New Jersey, especially in our system. And the way we managed it, just to give the perspective, we knew that the patients will come to ER, so we had to organize with our ER group and ER team on how to manage the COVID patients there, who gets in, who stays home. And we made different rules and processes to allow safe discharge home for young ones, for those who do not need oxygens. And we had to keep all the elderly and all the patients that had severe comorbidities and comorbidities that required watching. After the ER organization that we had to do, we also reached to our nursing homes around. And we had to meet with the directors of the nursing homes and explain the process, how to educate their teams, how to send the patients early in, and what to do to treat the patients. And that's where a lot of nursing homes have started their vitamin C treatments in the nursing homes. And hopefully it has showed some good outcome for those patients. Once the patients got into the hospital, unless they were intubated and went to ICU under Dr. Ghugnani service, all of the rest come into the telemetry floors. We went from an average of 1 on the 24th of March to 165, 170 patients that were admitted and inpatients in the peak of the disease. Going to that high number, we need to organize things, make sure that everyone is getting the appropriate care. The care in the first few weeks was a standard care established by committees in the hospital. And that standard care was based on the treatment that were given in Europe, because it was new to us. We needed to work based on the data that we were receiving from others. And that treatment consisted mainly on hydroxychloroquine and Zithromax, plus, of course, vitamin C and pronin and oxygen therapy. Unfortunately, as Dr. Ghugnani said, at that time, the patients were crashing fast. They go from a need of 2 liters to a need of 6 liters and high flow in a matter of an hour and a half, 2 hours. That fast crashing with that early virus, we have no explanation for that. We saw the outcomes were not that great, that using hydroxychloroquine and Zithromax with some supportive treatments like vitamin C were not getting us anywhere. The patients were getting intubated fast and getting sick fast. And we had to look out of the box at that time. And we had to look at what can help the inflammation, what can help the oxygenation, and the clotting that we started learning about, especially the data coming from Italy and saying that there are a lot of clotting happening. And that's where we included the anticoagulation therapy and the steroids based on markers, inflammation markers early on. And that was a big turnaround on our data. We were able to reduce our rate of intubation, our rate of mortality. At that time, we saw a much stable patients at that time. The third events that happened later on that helped us a lot was the availability of remdesivir and the availability of plasma. And those two also improved drastically the way we managed. We had to work with the number of vents we have, the number of bed capacities in ICU we had. So we managed about 30% of our patients on the floor had the criteria of ICU, but we kept them in the floor because of the overwhelming, capacities that were in the ICUs. Of course, Dr. Ghugnani was consulted in many of them. He to the floors and he checked on them himself. But we kept a good number of ICU level, non-vented ICU level patients in the telemetry floors. Myself, I do not have any explanations on why the virus was so aggressive in the beginning, why it is not now. Is the anticoagulation and anti-inflammation treatments changing that presentation that we're seeing, or is it new variant of virus? As you know, now they are talking about 6 variation of the virus that are available in the world. Are we talking about a new variation? I don't have that explanation. The numbers, from the numbers standpoint, the admitted patients in Capital Health right now are between 8, 10, 15, compared to 160, 170 just a couple of months ago. That says the huge difference between the two different eras. That's one thing. And also, they are not sick. They are not as sick. Out of those 10, maybe there are 0 or 1 that are in ICU. Most of them are in telemetry level. The other thing that we are looking at right now is most of the patients admitted with COVID positive tests got admitted for another diagnosis. It means that they come in for cellulitis and we check their COVID and we find that they are COVID positive. They come in with pancreatitis, we check with their COVID and find that they are COVID positive. We try to make a link. Are those things, whatever the diagnosis came in, is it related to COVID? But a lot of them are not. For example, patients fell at home and came in COVID positive. We try to see, is it true because of dehydration related to the virus or something like that? And we find out, no, patients are doing good and the virus being there, but not symptomatic for those patients. So that's where we are right now. Much more stable patients with COVID, less admissions and less sick patients with COVID. And I think what the states, both New Jersey, Pennsylvania, and New York have done is showing results right now. We went from a third rank of the worst state, or second rank of the worst states in the United States, to the 7th right now, when the other southern states are increasing their cases and more sick patients and more COVID patients. Thank you.
Thank you, Dr. Soudi. Now I want to bring the talk actually to Dr. Thomas Levy. Dr. Levy is a board-certified cardiologist and a board-certified attorney, so you be careful when you listen to or ask him questions. After practicing adult cardiology for 15 years, he began to research of the enormous toxicity associated with much of the dental work, as well as the pronounced ability of properly administered vitamin C to neutralize this toxicity. I was much impressed with one of the talks that I have listened in recent time, his application of hydrogen peroxide and success stories along with vitamin C. Dr. Levy is the top author and then top authority in vitamin C. He already published more than 12 books on this area. So we want him to initially tell us is like how the vitamin C should be used in viral infections, in infection generally, and then what is his recommended protocol, and then what would he do if next big surge comes in upcoming months in October. Yes, Dr. Levy, please go ahead.
Thank you. Let me start by saying twice now we've speculated as to why the cases of COVID seem to be a little less intense as they present to the hospital. And I can almost guarantee you, but I certainly can't prove it, that this is because from almost day one, by day one I mean late March, early April, when we started seeing this happen, and a group of us on the Orthomolecular Medicine News Service, our heads started writing about vitamin C, and he noted that within a few days to a week after that article, there was no more vitamin C to be found on the shelves. Walmart didn't have any, the pharmacies didn't have any, it was gone. I'm telling you, I think much, at least of the United States, people get online, they're scared, they're looking at everything. Vitamin C is an intervention, easy intervention. So I think that attenuation is because we have a whole lot more of the population on a gram or two of vitamin C, on 5 to 10,000 units of vitamin D, a little bit of magnesium. Also, you talked about the hydrogen peroxide. I had a similar experience as Dr. Andrew saw with the vitamin C, because about a month later, after working with these nebulizations of vitamin C for some, peroxide for some 9 months, I said, there's no way this isn't the optimal treatment for COVID, at least an optimal contributing treatment, not as a monotherapy. And to that end, I not only got an article out on Orthomolecular Medicine News Service, but I got a lot of coverage on this with Dr. Mercola's newsletter. And within about a week or so, Walmart didn't have a bottle of hydrogen peroxide to be bought. And I might add, that was 5 months ago. They still don't have a bottle of hydrogen peroxide to be bought. I had to go online with Amazon to get my own personal supply. So it's available, but it's just not quite as easy as going down to your local pharmacy. So first of all, I would submit to our esteemed panel here that I'm pleased to see how many people are using intravenous vitamin C. I would say just take the extra step on dose, okay? These patients, especially when they're in the intensive care unit and on a ventilator, they need a minimum of 50 grams of vitamin C IV daily, preferably because frequency is as important as dose, keeping the blood level from dropping below a certain level. So rather than give 50 grams as a one-time infusion, which is done commonly with physicians in their own personal clinics, give 12.5 grams IV every 6 hours. I guarantee you'll ratchet up the positive response rate in even your sickest patients. That's number one. Number two is, without spending a lot of time on it, I did write an article for Orthomolecular Medicine News Service, said, COVID-19, how can I cure thee? Let me count the ways. There are so many ways to cure COVID-19 because although it's a nasty virus, it's still just another virus. In the literature, there hasn't been a single virus that high-dose vitamin C has not eradicated. For those that don't know this, back in 1948, Dr. Frederick Klenner cured 60 out of 60 cases of polio, documented most of them by spinal tap with intramuscular and intravenous vitamin C. It's an absolute viricide. Now, with that in mind, vitamin C obviously is good to prevent, even better to cure. The hydrogen peroxide, and I just recently wrote on this, this caused a great deal of furor a bit when President Trump talked about inhaling disinfectant. So they started talking, oh, he's talking about bleach, he's talking about this, he's a crazy man. Well, let me tell you, inhaling hydrogen peroxide, nebulized as you nebulize the silver you mentioned earlier, is the perfect treatment for any respiratory virus, COVID included. Because where do you contract your virus? In the respiratory tract, in the nasopharynx, in the oropharynx, in the sinuses. That's where it comes in. And then it spreads to the rest of the body. But when you use the peroxide on a regular basis, and usually not that many times, you knock out all the virus in the head and neck area, and as I like to say, you chop the head off the viral snake. And then the body, especially with the help of the vitamin C and the vitamin D and the magnesium, you can then mop up the rest of the infection quite readily. Also, I don't know this being done, but it's covered in the literature quite nicely. Any nebulization that you can do to an ambulatory patient, you can also do to a mechanically ventilated patient. So I wouldn't deprive someone already on a ventilator of getting several 2, 3, 4 minute nebulizations of hydrogen peroxide several times a day. Now, the other point I would make, and boy, this is where politics crosses over with medicine. I've just been absolutely appalled. Well, for one example, sometime back, a month or two ago, the Nevada governor passed his own law that forbade physicians from using hydroxychloroquine. I've never heard of anything like that in my life. Regardless of how enthusiastic or unenthusiastic you are about hydroxychloroquine, I can tell you I've seen many cases work dramatically. Really, it seems like the only time it doesn't have a profound effect is when you start using it as a monotherapy latent disease. But in combination with the zinc, since hydroxychloroquine is a ionophore, and zinc appears to be the potent agent that actually kills the virus inside the cell by blocking and inactivating the RNA polymerase that the virus is used to proliferate, you get the zinc inside the cell, you get the salutary effect on killing the virus. So a combination of vitamin C, and you don't need to take the other supplements intravenously. Vitamin C intravenously if they're in the hospital, orally if they're not. Vitamin D, magnesium, preferably magnesium chloride, which has a very potent anti-pathogen activity above and beyond the other forms of magnesium. Some very interesting data on this. I don't have time to go into all of it. and the nebulization. Now, there's many things you can nebulize. I've nebulized a little colloidal silver in the past, as your brother using now, not for cancer patients, but just because it's a good anti-pathogen, antibacterial agent as well. But the thing that I use the most, and to me is the most effective, is when you nebulize 3% or close to 3%, 2.5, 2%, even 1.5% hydrogen peroxide, along with 1 or 2 cc's of DMSO, because the DMSO has its own anti-pathogen, anti-biofilm. Both hydrogen peroxide and the DMSO are two of the most potent ways to strip off any biofilms that have formed, and then the pathogens are easy prey, if you will. And the only time you can overdo this is when you start to notice irritation of the nose and throat. Well, then that's good. That means you've knocked out most of the pathogens, and now you're just having an oxidative effect on the mucosal tissue, and you stop, and that rapidly resolves, and there you go. So the other point I would make is I don't know why they're not asking in this country, what about South Korea? What about Japan? Both those countries had very few deaths, and the epidemic, the pandemic, has been over for 3 or 4 months. Guess what? They all routinely used hydroxychloroquine on patients, no matter how minimal their symptomatology was, and their hospital workers used it prophylactically. So I would submit to you, we have all the tools. If we can use them all, I feel, and I don't mean to exaggerate, this pandemic could be over in 2 to 3 weeks. But use vitamin C at a higher dosage. Go ahead with the dexamethasone. That's great. And the anticoagulants, excellent idea. For whatever reasons, there definitely is a procoagulant factor in this particular disease, that even if you get over the virus, somebody can end up with horrible long-term consequences due to emboli and other thrombosis. So do the anticoagulation, and I tell you what, the only reason not to use the peroxide nebulization is if you just think it's too cheap, because it works. I mean, tell me how the pharmaceutical companies are going to react to 10 cents worth of hydrogen peroxide doing what $50,000 worth of medical care won't do. So that's my points right now. So I'll relinquish the floor.
Okay, and thanks, Dr. Levy. I think your experience and your knowledge is really enormous, and we really are thank you for your input. And then all my colleagues are looking forward to your conference talk and also the workshop we are preparing for the functional integrative physicians in Turkey in October. I just want to share this. I wrote a book which I will be publishing in couple of months regarding COVID-19, and then all integrative approaches. It's a pandemic proof is the name. And in chapter 10, I'm sharing the history of Dr. Oliver. I don't know whether you heard, in 1918 and 1919, when they had enormous amount of influenza, he was a doctor in India. And when he had similar amount of hundreds of patients lying on the floor, dying back and forth, he looked for an option. And then he was a good, smart physician and knew about the hydrogen peroxide use, which was very common at that time. And he diluted the hydrogen peroxide to these people who are about to die, and he gave them IV. And then out of, I believe, 13 patients, 12 of them survived. He wrote this actually in Lancet. It's still there. I shared actually the copy of the original article and his protocol, how to prepare even the IV hydrogen peroxide. And then unfortunately, nobody wants to replicate study like this because number one is not a patentable, a cheap item. Number two is that politics gets into the way. But nobody is going to prevent us using it as a nebulizer. I'm up for it. And I'm very happy that you brought the important information about hydrochloroquine use with zinc. Without zinc, hydrochloroquine is not going to do the job. It's an ionophore. It opens the door for the zinc to get into the cells, and then inside of the cells kill the virus, where the RNA virus is replicating. So I really loved all your comments and approach, and then I hope we will not get a big surge in October, but if it comes and if people all over the world hear what we are discussing here, and then with a common sense, do this. If they want to do double-blind controlled studies, let them do it. But I know that you know that this is working and it's going to work. By saying this, I'm going to bring out some other important matters into the picture. This virus is a little different than other viruses, and then has all these spikes, and it has a way of entering into the cells by making special high frequency movements on the S spike proteins. Germany and researchers there discovered effect actually blocking maybe replication of virus with another approach with a copper. Actually, my brother Ibrahim Obuz, when he sent me all these articles and then success stories, what he had and his friends in Istanbul, I wanted to really bring that into conversation today. One other thing is another known anti-viral colloidal silver has never been actually allowed to use by doctors in the United States because of questionable toxicity. But my brother's company and then his researcher friends found a way to make it into like a nanotechnology and very, very low doses in a nebulized form. He also shared me all his success stories with these very sick patients that he treated in his private practices. So by saying this, I want to bring Dr. Ibrahim Obuz to picture and have him share his so-called anecdotal and an evidence-based approach to treatment of COVID-19 patients when he was in Turkey. Ibrahim, go ahead, please.
Thank you, Dr. Obuz, for inviting me to this program, and hi to everyone. I would like to share you our experiences with the COVID-19 positive patients. When COVID came to the Turkey, everybody panicked as all over the world. And we started to treat them with Zithromax, hydroxychloroquine, vitamin C, high doses. These three agents was enough for the beginning. But COVID positive patients in the hospital, there are three types COVID positive patients in Turkey. First, hospitalized one. It is easy to give them IV vitamin C. The second one, without symptoms, COVID positive, but they have to stay, at home, minimum 14 days. We start to think that time, what should we do to give these patients vitamin C, high dose? And we invented activator. When you give vitamin C orally, 10 to 15% only absorbable from the intestine. But with our activator, we achieved the 95%. And we started to give 15 grams a day as a protection, COVID positive patient, but they live at home. Another question was, very bugging us. How are we going to protect our doctors, nurses, and hospital workers? And one of our colleagues, who is Miss Hatice Çelik İlközen, alternative medicine specialist, she invented a vest. You can wear it, copper vest, and protected 100%. We used two agents, nanoparticle silvers. If silver is pure, without cadmium inside of it, it is non-toxic. Okay? We separated cadmium from the silver, and we had pure silver first. After that, with nanotechnologies, 200 ppm or 300 ppm nano silver is given by nebulizator to the COVID positive patients with symptoms. 24 hours later, our PCR test results came out negative in the ICU units. I have more than 100 patients with lab test results. Also, another 20 patients in ICU units in this private hospital, more than 50% of them was intubated. And we thought that what to lose? This is non-toxic copper, vest. It doesn't touch the body. It is inside of the vest, okay, with its own activator also, another product inside of it. Miss Hatice invented and patented product all over the world. And our infectious disease clinic decided to use this copper vest with the intubated patients. It turned out that, as I sent lab results to you via PDF pages, you can see that in one day, lab test results turned out positive. And CRP levels went down very fast in 2-3 days. Maximum in 3 days, all patients recovered in the ICU units. And all of them documented with lab test, laboratory test results. Also, with nanoparticle silver, more than 100 patients PCR test results in 24 hours, 72 hours turned out to negative. And we said, if we give these vests, okay, copper vests to the hospital workers, what's gonna happen? And another German company did the same thing. What we did in Turkey, what Miss Hatice did in Turkey with the copper. This German company made out the copper, how do you say, you know, all of the people in the shopping mall, they touched the, you know, yeah, door handle or something. They found copper kills the COVID-19 in 1 second, 99.8% success. And after then, they started to produce all kind of appliance. You can apply this one. It sticks, you know, to the appliances, to the buses, trains, you know, everywhere. You can apply it. Because when virus comes and touches the copper, kills over there, dies over there. And we say, why don't we use this copper vest for our doctors? We used with the infectious clinics in doctors and nurses. It comes out last 3 months, none even one COVID positive hospital workers. What I'm saying is, of course, we are going to use the Zytromax, hydroxychloroquine, vitamin C, anticoagulants, steroids. Whatever we have in our hand, it is proved protocols, but nothing to lose using nano silver nebulizer and the copper with COVID positive patients, because when you use it, you'll see that results turns out maximum in 3 days PCR test negatives. Thank you for listening to me.
That's very interesting, because I was a few days ago, I was reading something about copper face masks being used for prevention of COVID, and they had better success than the N95s.
Yes. They made so many things in Germany, you know, with copper.
There is a Israeli company that has a production facility in Virginia. They are actually oversold all their stock for next 3 months in the United States, and basically they knew how effective with the healthcare workers, and then they are only selling to healthcare workers, and then some in Amazon now. Actually, if you are interested, Dr. Gugnani. So basically, at this point, Gökhan or Fatih, are we getting any questions from our live listeners? Any questions coming from?
With that, Can I ask from Fatih, please? I sent him the PTF pages. Over there, there is a picture of this vest. Can he show it?
Yes.
Easy to use, very comfortable. You can use it 24 hours. Elderly people, people with diabetes, hypertension, heart disease, they can use this copper vest. Protects 100%.
Okay. Dr. Levy, may I ask you a quick question? Are you still with us or you left?
On what?
Dr. Levy, one quick question. I have been searching for reasons on number of statistics. And if you look at the statistics, as Dr. Mercola mentioned in that video that you sent me, initially, when the statistics were looked at it in China, the people who died from COVID, 80% of them, or 70%, 80% of them, more than 70-year-old, and then they had comorbid diabetes, hypertension, and then most important factor, he was talking about insulin resistance. And then the other studies came from Italy, and then people, more than 80% of people who died, they were again more than 70, 80 years old, and they also had the same comorbid conditions. Are these the conditions at high plasmin level diseases? Because I know that there is some close relationship with the plasmin and how the plasmin is used by the virus to enter to the cells and to replicate itself, to find its way into the cells, like high circulating plasmin. Have you run into any studies? And then can this be another approach to prevent this virus entering the cells and making elderlies vulnerable to sick in the future?
Well, that's a new one for me. No, I haven't run across any literature looking at the plasma levels and the morbidity and mortality of COVID.
Yes.
Let me say that I first encountered this disease in March. On a personal note, when one of my best friends, extremely healthy, 50-year-old guy, exercise, takes all the supplements, does everything, and he got severely short of breath in the middle of the day, taking out his garbage, and then he just went into a picture of acute respiratory failure. He didn't want to go to the hospital because at that point in time, he figured he'd just get put on a ventilator and then die a month later. Fortunately, he was such a bright fellow, he found some black market chloroquine that he got a hold of before all this started. He took a couple of the capsules. 3 or 4 hours later, he started getting better, continued it, and he was well 2 or 3 days later. At that point in time, because there were still occasional young people, a 25-year-old lacrosse player, super healthy. I mean, he got the virus, went straight to the ICU. I said, something's going on here. And I don't know if this is the answer, but I reviewed some of the statistics on the countries around the world at that time where death rates were the highest and death rates were the lowest. And some of the lowest at that time were in South America. And at that time, I was also thinking about the zinc. Okay, if you have a primary zinc deficiency and you're not taking zinc with agents that get it inside your cells, that's going to be a predisposing factor toward a very symptomatic and vicious virus. And I looked at the typical diet for zinc content in South America. They have an incredibly high level of zinc in their diet on all the common foods they eat. The lentils, the avocados are astronomical in zinc. I mean, there's not a South American I know of that doesn't eat avocados every day. Okay, all the meats and a number of other common foods, including certain cereals. So my speculation is, and it's an oversimplification, but I think just like we know people are enormously depleted in magnesium, I'm sure if we ever started doing the testing, we'd find an enormous number of people that are zinc depleted. And if they are not able to assimilate enough zinc rapidly, they're definitely going to be sitting ducks for this virus. although that's not to say vigorous IV vitamin C and everything else still can't bail them out of it, but we're talking about the unfortunate individuals that get the disease and are doomed to have doctors that really do nothing but give them support in the hospital and hope that their immune system eventually kicks in.
Just to let you know that I started checking every single patient. I'm screening for exposure-related PCR test for COVID-19. I started checking their zinc, plasma zinc, and serum copper levels. And I will be having like some couple hundred patients number in my hand, and then I will see which ones converted and which ones not. And I was doing actually before that zinc level measurement for depression and all mental neurodegenerative diseases, because it's very much related with most of the things that people are on Prozac and others. So it's simple zinc will be easier to fix and less toxic than having all these side effects. So one of the good thing about zinc, copper, and orthomolecular approach that people really need to learn this in medical schools. It's not being taught, but it's a good opportunity for them to learn in workshops like we will be giving to Turkish physicians in upcoming months, and through the internet now, maybe more of the people, the consumers are educating themselves, like finishing up everything in the store. Soon, maybe we might not be able to see zinc also. All right.
I suspect that aside from magnesium, zinc deficiencies are probably the most common mineral deficiency we have throughout the world, and especially in infectious diseases. Zinc is incredibly important, not just for the mechanism that we mentioned earlier, but by other mechanisms as well.
We should also talk or add about the iodine, how important it is immune system strength, because Dr. Wright, you know probably him very well, has always mentioned in his talks and in the internet and in person, before he goes to any travel with plane, he always takes his iodine with him. And then also important matter with how and why people should be using also iodine in the time of COVID. And then maybe the last question I will ask you is about what do you think about ozone and treatment for the COVID-19?
Ozone, in a nutshell, is what I refer to as magic gas. It does everything you want it to do and nothing you don't want it to do. And the only toxicity that I know of with ozone is if you inhale it directly. But I don't believe there is any substance on the planet that is a more complete destroyer of all pathogens than that particular agent. Okay, then you have the advantages of it diffusing rapidly, however you apply it, whether intramuscular, subcutaneous, even intravenously, or treatments of the venous blood with ozone. But by mechanisms that are still unclear, it not only has an enormous pro-oxidant effect in destroying pathogens, it also has a measurable antioxidant effect post-administration. But if you had one thing that you could do, and I don't mean to undermine everything else I said, but if you had one thing that you could do for any patient with any acute viral infection, go for the ozone. It's just that it's not that widely available. A lot of doctors aren't familiar with it. It takes a little expertise to know how to use it, but it's incredibly, incredibly effective.
I actually, Dr. Mercola and myself, actually, we have interviewed the expert on ozone, and we have videos actually in the internet. All they need to put either Dr. Mercola, my name, along with ozone, and they will see. And he has done an enormous job in West Africa. I'm deliberately not letting his name known because I want people to do a little search and get to know.
Right.
Okay, so thank you. And iodine, what is your
what I wanted to say too there is, now before everybody has their favorite supplement and comes at me with teeth exposed, there are hundreds, if not thousands, of quality supplements out there, and they can all have a positive effect. But you can't take 30 supplements a day. Either you can't afford it, or your stomach can't tolerate it, or you don't have any appetite left for your food. I maintain the top 5 supplements whatever else you take, don't fail to neglect, take these top 5. That's magnesium, vitamin C, vitamin D, vitamin K2, and a form of iodine. Okay. The top 4 are all direct antagonists to calcium, and calcium excess is the etiological factor in all the cells of your body that have increased intracellular stress and are diseased. These are calcium antagonists, and each one of these things, magnesium, vitamin C, vitamin D, and vitamin K2, have separately as monotherapies been shown to decrease all-cause mortality, which means they positively affect every cell of the body. Now, all the other ones, there's a lot of good ones. I'm not putting down the B vitamins. I'm not putting down anything else. But those 5, in my opinion, if you're bothering with supplements at all, you shouldn't neglect those.
And what form of iodine are you using yourself?
I use iodoral. I don't know that the iodine drops. Those are horrible tasting. No, I can't deal with that. I just take the iodoral, about 12.5 milligrams a day.
Dr. Levy, I would just what's your opinion on quercetin?
Quercetin.
Actually, I don't know. I pronounce it quercetin, but I don't know for a fact that my pronunciation is correct. Quercetin is excellent. Okay, and some authors, Dr. Mercola is one of them, and I respect his opinion on many things, most things perhaps. Quercetin is an excellent ionophore, and that's something that should be better transmitted to the public, since we still do not have widespread availability of hydroxychloroquine as an ionophore. Anybody can get on Amazon and get quercetin and can get a good form of zinc and make sure they're on those 2 supplements, at least in terms of COVID prophylaxis. But no, quercetin is excellent.
Okay. Any other questions for Dr. Levy or other panelists here?
Dr. Levy, there was one, I can't remember the name of a Canadian professor. I watched his lecture around a couple of years ago, and he was and ever since then, I've been a very strong advocate for vitamin C. And he talked, I can't remember his name, he's out of a Canadian university, and he talked about giving 1 gram of vitamin C for every 1 year of your birth. So if you're 10 years old, you take 10 grams, and he gave 1 gram for every year. And he basically said that his kids, he started that with his kids, and his kids have been in college and have never ever had a cold and never ever been sick. I can't remember his name, but it was one of the few lectures I watched on vitamin C. It was an eye opener for me.
He was following the primary advice of the true pioneer of vitamin C, and that's Dr. Frederick Klenner. I mean, Dr. Albert St. George, he discovered it, got the Nobel Prize. Linus Pauling, many years later, brought it into the public eye. But Frederick Klenner, in my opinion, and I don't use this word loosely at all, was the genius that got vitamin C rolling. And that's exactly what Klenner did, was he said a gram per year of life per day, roughly. Okay. But what still amazes me to this day is how Frederick Klenner, 3 or 4 years after vitamin C was discovered, got this crazy idea inside his head to start giving megagram doses of vitamin C intravenously to patients for infectious diseases. Where the heck did that come from? I have no idea, but whatever his thinking process was, he was spot on.
Actually, I know we're talking about COVID, but I want to let you know that I used vitamin C for septic shock in some of my patients in the ICU, and in a matter of 24 hours, they were off 3 pressors. It was unbelievable on the patients it worked on. Now, if you use it too late, it's not going to work because you've gone into refractory shock and nothing's going to help that. But if you use it early on, I've seen really phenomenal results with using vitamin C in septic patients.
Let me say this, and I mean no disrespect and don't want to take anything away from Dr. Marek, because he played a huge role in getting vitamin C a spotlight that it never had before, for sure. But I would tell you that the thiamine is unnecessary and the hydrocortisone is unnecessary. In sepsis, you already have a natural state of high endogenous cortisol levels. They're just ineffective because the cortisol receptors are oxidized. You bring the vitamin C and oxidize those receptors, then the hydrocortisone, and this is a known property of hydrocortisone, starts pulling the vitamin C into the cell like crazy. A bunch of Iranian researchers a year before Marik did basically the same thing as Marik, except all they used was 1.5 to 2 grams of vitamin C every 6 hours without the other 2 items. I would tell you, though, is if you run into that sepsis patient and they're truly on death's doorstep, don't give up until you've given them 25 grams every 6 hours, 100 grams a day. You're going to pull out some of those that even look like they don't have a chance.
Wow.
I'll share you this. I wish Dr. Cheng was with us. Dr. Cheng is another integrative practitioner who got stuck in China and then actually led the forefront of vitamin C use and then also clinical trials in China. And he was very happy when I invited him because of the time changes in the middle of the night. Probably he couldn't get up at 3 a.m. to join us, but he was going to share us his high dose results with 25 gram a day in ICU patients in China. He shared this story when I interviewed him, and then this reflects to what you're saying, Dr. Levy. During the pandemic, one patient's ICU ventilator settings were going so high, and then she was in impending doom of death. And the doctor who knew Dr. Cheng and then knew the high dose use from Dr. Cheng's training, he said, what would I lose if I give 100 grams of IV slow push in 4 hours to this patient? Very high dose. And when he came to 80 gram, the ventilator settings from very top came to almost nothing. And then they extubated this patient following day. And this was the patient about to die. And then no more word can explain what you're saying. Is the clinical response. And then he published this patient, actually, this doctor.
And let me say this. The bulk of the reason for that is that you got to pay the piper, okay? For whatever amount of oxidation is going on, you need an equivalent amount of reduction. So if you have massive oxidation, as you have in sepsis and you have in advanced diseases, you can take a dose of vitamin C that will cure somebody of a minor illness or a minor infection just like that, and it's not going to touch somebody that has tenfold more oxidation than the reduction power that you're administering. There still remains no established toxic dose of vitamin C, okay? It's a nutrient, really. It's not so much a vitamin as it is a nutrient. And it's the primary nutrient on which every cell in your body runs. So taking too much vitamin C is like, I don't know, taking too much organic food. You can't really overdose on vitamin C.
Okay.
So you shouldn't be afraid in an extremely ill patient, especially if you think the patient is going to be dead in 24 hours. It's amazing how many doctors won't do that and say, well, I don't want to push him into renal failure. Well, number one, you're not going to push him into renal failure. And number two, what did it matter if you did push him into renal failure if supposedly he's going to be dead in 24 hours anyway? Go with 100. I mean, we've gone, Dr. Honey Hackey and I at the Reardon Clinic in Wichita, we've had patients where we routinely give them 125 grams a day.
Wow.
Okay? So don't be afraid. It's just as long as they're well hydrated, because vitamin C is concentrated, so just make sure you're giving good hydration and not causing volume contraction, they'll do fine. Let me say as a side point, all this garbage about kidney stones, let me make this clear. Vitamin C produces oxalates, many other things do too, and most of your stones are calcium oxalate. Well, what about the calcium? It's the calcium that is the culprit. Large amounts of vitamin C protect you against cancer stones and even help you dissolve pre-existing stones. So calcium is what causes kidney stones and other stones throughout the body. This is covered in my book, Death by Calcium.
Thank you. All right.
Is Manish okay? His face just disappeared off the screen. Is he?
I think
I'm here.
he's using virtual background.
You just disappeared like there was a
I'm
trap
here.
door.
No, I was just.
I have a
I'm
question.
a big fan of vitamin C. The only problem is that our hospital, the pharmacy comes up and tells us the cost.
Well, it
I
doesn't
have-
cost as much as chemotherapy, does it?
I know. I agree with you.
Or what's the cost of remdesivir?
No,
Oh God, jeez. I'm not even sure that. I'm not even sure that works, because when they were working doing the remdesivir, our hands were tied. We were told not to use it on a very sick patient so they can come out with good data.
Yes.
You know, there's a lot of things we could do to help complementary medicine get accepted, but I'm going to tell you, if we could get the powers that be, the president, whatever, to do one thing and one thing only, everything else would take care of itself. And that one thing and one thing only is to pass a law, executive order, whatever, that says Medicare and any private insurance must reimburse the patient for whatever type of medical care they choose.
Absolutely.
You do that, and it all comes tumbling down. Right now, I can't tell you the number of patients, cancer patients, they want so badly not to take chemo, but to take vitamin C. Their chemo is going to cost $50,000. Their vitamin C is going to be $2,000, but the vitamin C is $2,000 out of pocket, and the $50,000, incredibly enough, is covered by the insurance of the Medicare. So they just go where the economics push them.
Yeah. Unfortunate care of current status.
I have a question for the panel, please.
Yes.
Yeah. So one of the big problem we run into in hospitals, since they most of them are managed by non-physicians, and they go by rules, and there is a lot of system-based protection that are there to not deviate from FDA and from what is the norm of treatment of diseases. You need a large controlled trial to say, okay, I will not give chemo to these patients and give them vitamin C, or I will treat only with high dose vitamin C on those sick patients and see the treatment. Why do you think that there is no good, well-controlled, large studies with high dose of vitamin C to help us institute that in hospitals?
Well, they basically know what the answer is, and they don't want to see that answer established, would be my point. One thing, though, is that the oncologists, that actually might have been due to something that I said in a lecture 12 or 13 years ago. I said something like, chemotherapy is a toxin and vitamin C neutralizes toxins. Next thing I know, I start seeing blogs with oncologists. You can't give vitamin C because it neutralizes the chemotherapy. Well, they didn't listen to the part where you stagger it. You give the vitamin C now, a few hours later you give the chemo, they both get into the tissues. But we now have not either or studies, but we have multiple clear-cut studies that show if you take vitamin C in addition to your chemotherapy, you live longer and you're less symptomatic. So we do have a few more oncologies gradually coming on board and at least embracing vitamin C to the extent that it makes their chemotherapy look better. But those double-blind trials, you need a deep-pocketed pharmaceutical company to do that type of trial. All those trials are multi-million-dollar trials, and that allows it just to be in the realm of the pharmaceutical company to push their drugs. I mean, do you think a pharmaceutical country is going to do a trial comparing any of their drugs to nebulization with hydrogen peroxide? Of course not.
But there were some good controlled studies for, generic medications like the steroids now for COVID was done in a well-controlled study. and without any pharmacological or pharmaceutical involvement. Same thing happened with hydroxychloroquine, but we have nothing for high dose vitamin C. Nothing there.
Actually, there's many studies there. I mean, I mean,
I
not specifically for COVID, but for many other conditions. Okay, so when they say nobody's got a big long-term double-blind prospective study for COVID because it's only been around for 4 or 5 months. But no, vitamin C is one of the most studied substances on the planet. I do legal consultation on doctors and dentists with malpractice suits that involve taking vitamin C. And it's sad and almost hilarious when I get the initial complaint and they have some expert. And in one case, they made the statement, there is no evidence in the literature that vitamin C is useful in any infections at all. I mean, how many thousand studies would you like, sir? So I write back and say, look, you need to get a different expert because this expert doesn't have a clue as to the basic information that's available to anybody in the medical literature. So we're fighting a perception much more than we're fighting science. We have the science. If we ever had an objective forum where all the parties were allowed to openly exchange ideas, openly exchange articles, and not be canceled as we are in our woke culture these days, the data is all there already. Believe me.
Okay, maybe Dr. Levy, share me some of the studies that you mentioned, and then I'll forward to Dr. Suidi and all the others, and Dr. Mukundani and their colleagues, actually.
Well, it's easy for me just to send an ebook because that's got all the studies in it rather than me just sending individual papers.
Yeah, that'll be great. Thank you. I appreciate it.
Sure.
Okay. This brings us over 1 hour since we started a little late. Gökhan or Fatih, how are we doing in time? Are we supposed to be 1 hour or more? Hello? Okay, so we still have some time to discuss the current surges in United States. Dr. Levy, are you worried about living in Florida? I assume you're in Florida, is that right? Because of the recent surges in numbers, and then I don't want to ask your age, but you're in the certainly category of list that people will try to keep you inside home, like
69.
So, what do you think about the current surges and how it's being handled, and what should be done? Is it like absolutely necessary to have another lockdown, or can this go away? What is your thoughts?
Well, I'll be very honest. Until I came across my peroxide nebulization, and until I saw my good friend recover so rapidly with chloroquine — he took chloroquine, not hydroxychloroquine — I was scared as hell. But since I have those things now at my disposal, since I can give myself with a butterfly 12 grams of vitamin C IV push anytime I want, I'm not personally apprehensive at all. But I absolutely understand the panic that so many people are in, and unfortunately the degree to which politics is, in my opinion, taking advantage of that panic. But the fact of the matter is, it's a crazy virus. Maybe the flu still kills more people, and maybe the flu affects different groups of people, but there still are enough cases of younger people, enough cases of the coagulopathy that Dr. Suidi, did I pronounce that correctly, has treated. This has a lot of different characteristics than quote-unquote routine viruses. In other words, with the flu, unless you're a severely advanced illness, you go home and go to bed and take your vitamin C and take your other vitamins and get liquids and hydration, and you're going to get over it. That doesn't appear to be the case. If you get a bad advanced case of COVID, you start to go into respiratory failure before you have a chance for the virus to start manifesting all the typical flu symptomatology that you see otherwise. So then, in direct answer to your question, I think people should be on at least, well, a minimum of 2 grams of vitamin C a day. Better if you're taking at least 2 grams 3 times a day. If you're looking at acute prophylaxis, your vitamin D dosage should be 10,000 units a day. And if you develop any sort of symptoms, don't be afraid to take 100,000 units of vitamin D for 5 days, okay, and acutely bring up those levels. The zinc, of course, is important, and the magnesium is important. I said before, especially magnesium chloride. This is a pretty amazing fact to me, just like I mentioned earlier that Dr. Frederick Klenner cured 60 out of 60 cases of polio with intramuscular and intravenous vitamin C. Dr. Nouveau in France used oral magnesium chloride to cure 15 out of 15 cases of polio as well, some of which were advanced already with some degree of paralysis. So I certainly wouldn't recommend magnesium chloride as a monotherapy to see how it worked on coronavirus, but it absolutely should be a part of the formula, if you will. So those
what's the
supplements.
dosage? And what's the dosage on magnesium chloride?
Magnesium chloride, it's I think it's
400?
25 grams in 1,000 cc's of water. And I have the formula. I don't want to misrepresent the formula, but it's a fairly small amount. And then do that. And I can't overemphasize really the simplicity and the importance of hydrogen peroxide. It's also a wonderful preventive therapy. Let's say this would be perfect for the hospital worker, even if you're taking everything else. If you've taken care of the COVID patients all day long, go home, not for 15 minutes, go home and nebulize for 1 or 2 minutes. And you just clean out the oropharynx and the nasopharynx, and you're fine, okay? But if you already feel a little sore throat or tickle, or you're starting to get a runny nose or headaches or eyes hurt, well, then you just do it for 15 minutes and repeat it several times a day. And I guarantee you 9 times out of 10, it's going to be gone in 24 hours. It's just an enormously incredible, potent, and I don't think there's anything less expensive on the planet. I didn't exaggerate when I mean, a pint bottle of hydrogen peroxide costs you 88 cents. A pint. 2 cc's is all you need to nebulize. So it's less than 10 cents. It's 3 cents a dose. Okay, so, you can get food grade hydrogen peroxide and pay a little more, and that's fine and good. But if it's not something you're doing on a regular basis, there's no toxicity to speak of with the over-the-counter hydrogen peroxide.
Sounds great. Thank you.
Sure.
Ibrahim,
Yes.
can you let our viewers to know how much vitamin C you are using on your patients? And also, how are you doing the nebulization? How much you are using the colloidal silver nebulization?
Okay, vitamin C, if patient is at home, 15 gram oral, 15 gram with activator, it's enough for them. If it is in the ICU unit, hospitalized patients, 30 gram per day we are giving intravenously. For nanoparticle silver with nebulizator, 10 let's say 1 cc nano silver has 300 ppm, okay, and we give them 10 cc every 6 hours. For copper west, we start using from the beginning, but we have tested using nanoparticle silver and the copper west together. It's more successful, reduces the time of healing, but even not using single medicine, if patient wears the copper vest, because copper vest creating unhearable small sound waves. When you put these silvers, dorsal side and frontal side, okay, 2 pieces, This creates a frequency over there. This frequency causes the distributions, electron distributions on the membrane of the viruses and cause apoptosis. That is why we are getting PCR test negatives maximum in 3 days. Do you know what does that mean? That means nothing left behind of the viruses. Even we tested so many patients in Turkey. They were positive immunoglobulin G, okay? 3 months later, even they had COVID in the past, that's why they had immunoglobulin G positive, 3 months later turned out to negative. This means there is no steady immunization against this COVID-19. And this virus is changing his codes every day. For example, one group of our patients, they had only cough. Another group of our patients, no cough, no high fever, only muscle ache. And one group of our patients, they came with the complaints of diarrhea only. But they were COVID positive. You know, when Mr. Levy said very nicely, you know, their perceptions is bigger than the science, okay? Perceptions talks first because they don't see what kind of waves coming out from copper. They don't see what does nanoparticle silvers. Do you know the silver known as all 696 bacteria, viruses, funguses, and chlamydia kills directly. Silver kills 698 type virus, bacteria, fungus, chlamydia. That's why when I give nanoparticle silver via nebulizer to the patients, cancer patients, lung cancer, 3.5 centimeters on the left upper side, blocked the bronchus, okay? Patient had to go to surgery room. They decided to take out the right lung, but now patient is living and you have his BT results in 15 days. Nanoparticle silver reduced size 50%. Now it's 70% reduced. Also, let me tell you what is the mechanism of the copper and nanosilver working together. Nanoparticle goes directly inside of the virus inside of the tumor cells. Copper creates frequencies in the body, and also, you know, we are using coppers in Turkey treating for the atherosclerosis. Treated with copper patients, what was it? It was about 80% or 90% occluded heart blood cells came down to 50%, 55% with the copper therapies. You know, without any prejudice, our doctors has to open their minds with the natural treatments and alternative medicine, complementary medicine, because before we do, German doctors used the copper, after then we start using in Turkey. But inventor Miss Hatice Çelik working with the copper last 15 years, and she started working with the copper in Azerbaijan. They learned so many alternative medicine treatment from the Russians and Far East people. Now we brought those treatment products to the Turkey, and our success rate is 100%. Treating with COVID. With cancer, our success rate is 98%. Of course, I am giving high doses vitamin C for cancer patients, high doses vitamin B17. B17 level is very important. zinc level is very important. Using the bioresonance therapy is very important. Using immune modulator agents. The German using orthomols, we are using Immucil. It is our own product. Immune system, also copper, West, increases the immune system. You will see from the lab test results I sent you, also Fatih has. I asked half hour ago if he has in his hand, he can show the type of the West and the lab test results in 3 days, how we treat the COVID-19 patients.
Thank you, Ibrahim. Thank you for sharing.
Thank you.
Before we end the day's discussion in COVID, it is very clear that we have started with very aggressive virus that started killing thousands of patients due to untoward complications of hypercoagulability and respiratory failure. But two things happened to make all of us less anxious and worried. Number one is rapid evolve and changes in genetic makeup of this virus, which is clearly stated by our clinicians, how they are seeing less sickly patients, and then all the numbers maybe we are seeing is just like bystander numbers. Patients are coming to hospital for other reasons, but since they have the COVID-19 label, since everybody is getting their routinely checked, and then they are placed on the list of the numbers, and we should stop treating the numbers. We should start treating the patients with existent effective treatments. We need to take the horse glasses out, use wide angle lenses to see more of the options available for our patients. And God forbid, if second surge comes, now I feel like with the event like this and many more events, doctors will be more awakened, and then we'll start using very effective and cost-effective treatments. Before we hang up, Dr. Levy, I want to give you an opportunity to share your information about liposomal vitamin C. I know that you have invented. If there is a way of our viewers to be able to obtain it, where can they get and how they can get it, please? And I'll give you the closing remarks.
The liposomal vitamin C is a very interesting form of vitamin C. Liposomes are very tiny, nano-sized structures that are literally, in every sense of the word, artificial cells. And that's why they were first started back in the 1960s. They wanted a model for an artificial cell. So the membrane around the artificial liposome is actually the same composition as the membrane of a regular cell. And so this allows these, whatever's encapsulated, in this case vitamin C, to not be affected by the stomach, to be almost 100% absorbed, and selectively to go into the lacteals rather than the capillaries. So rather than go through the portal circulation, you go straight into the lymphatic circulation, get taken up inside the immune cells, and then what's left goes through the lymphatic circulation, then goes through the blood, into the blood from the thoracic duct. Clinically, without going into a lot of detail, I can just tell you that a gram of properly encapsulated vitamin C orally, in my opinion, has a clinical impact of 5 grams given intravenously. Now, that may sound outlandish, but the point is the delivery system. The liposome encapsulated vitamin C can get inside the cell by multiple mechanisms without the consumption of energy. When you take vitamin C, even intravenously, the reduced vitamin C needs active transport to get in the cell, consuming energy, or the oxidized form of vitamin C passes through the SVC2 transporters, but it still needs to consume energy to be brought to the reduced state. So it's like robbing Peter to pay Paul. You need to use energy to get your energy containing substance where you want it. And for the most part, not 100%, but for the most part, where you want your vitamin C reduced and running the show is inside the cell, along with glutathione. So the liposome vitamin C, I really only have one I can recommend, there's so much fraud in this area, and I wrote an article on that, is Live On Labs, and their website is livonlabs.com. And I put my email address in the chat area here, so anybody that wants to write me or interact or exchange ideas, exchange papers, feel free.
Thank you.
I have a good news. Dr. Chen just send me a message. He is able to join us. Can we just give a couple minutes maybe to have him join in and share us some of the clinical data that Dr. Suidi is looking forward to? I told him just join. He might be joining in a couple minutes. Let's wait and then hear what is his good news for us from China, because he told me in the email that he would be sharing some preliminary unpublished data for vitamin C. If I may be excused, let me chat with him and then let me bring him on board. Fatih, can you resend the Zoom instructions to Dr. Richard Cheng's email? Dr. Richard Cheng, he's waiting in the instructions to join us.
Fatih ekranı 5 kişilik yaptı ama 6 kişiyi nasıl sığdıracak?
Maybe we can take you off, Ibrahim.
Okay.
All right.
Okay, I was told.
This is what happens if you have a brother on the show. You can easily kick him out. So, by the way, since we are waiting for Dr. Cheng to join, Dr. Gugnani, could you give us your background, and then Dr. Suidi also, because you're coming from a diplomat family and you're exactly looking like a diplomat today. Can you tell us your background also, like how you ended up coming to the States, like all of us, half of us here in the show, your clinical and then research backgrounds, because we both have good research background as well, please. Dr. Gugnani, you first. And that's maybe
Unmute.
Muted.
Okay.
Yes, so I grew up in Nigeria, Africa. That's where I grew up. My father was a professor of medical microbiology, and he had emigrated there and did my medical school there. And then I came to the United States, where I did my residency in Lutheran Medical Center, which is part of the NYU program. And I did my fellowships in pulmonary critical care and sleep in Wayne State University, Michigan. And right out of fellowship, I got a job at Capitol Health, and I've been here ever since.
So what are the areas that you have published that your interests are?
Well, I have published some papers in pulmonary hypertension, the use of nitric oxide in that, in pulmonary hypertension and pulmonary capillary hemangiomatosis, and in my work as a medical student in Nigeria, I worked on ivermectin, actually, which is now being used for COVID patients in South America and this thing, but we used it for the filariae worm over there when it first came out. And right now in the residency program, we're working on case reports with the residents, and we are working on 2 papers right now. One is the use of tocilizumab in ICU patients during the COVID era, and the steroids, because we started using steroids later on, and we're comparing the 2 population of patients that we used, that we had steroids and non-steroids.
Okay. Fatih, I heard Dr. Cheng joined us. Dr. Cheng, Are you ready to join us?
Yes, just one sec.
Okay, good. So, Dr. Sweetie, go ahead and tell us your background while he's getting ready.
Well, it's similar to Dr. Gugnani. I grew up in Africa. My father was a diplomat, was assigned to Moroccan embassies. And when I finished my high school, there was a medical school by the WHO in Niger. And it was an opportunity for me to be part of that. And I was trained there. I trained also in Morocco, in UIN before I came here. When I came to United States, I did a master's in health services administration, an MBA. I worked for the state health department of Arkansas, and then I joined the residency back again at Cal Health. I stayed as a chief resident, and then I started my practice, as you know, both inpatient, having a large hospitalist program covering multiple hospitals and nursing homes, and a few offices outside. Late in 2018, beginning 2019, we joined with the hospital. We merged with the hospital. As many of those who practice in the United States know, living with the health insurances now as an independent physician is not an easy life anymore. So that pushed into that merger with the hospital.
Thank you again. Dr. Richard Chang just joined us. Richard, I'm sorry about the mishap. You couldn't reach us, but before you joined us, most of our clinicians have shared their results, really enormous experience. And Dr. Levy, who's with us, who know you really well, has also trained all of us in that how to use proper dose and then dosing of vitamin C in COVID patients. I know your story about how you ended up in China for COVID, but you are very much involved in double-blind, placebo-controlled double studies in vitamin C use. And then I know that you have a lot to say to us. Please go ahead and then introduce yourself first, and then your experience, and then what you wanted to share with the rest of the world. Go ahead, please.
Oh, thank you, sir. Thank you, my friends all over there. And sorry about missing the. I didn't realize because it's 3 a.m. over here. But anyway, yes, I have been stuck here in Shanghai since January, right? About 2 weeks before COVID-19 broke out here in China. And well, that's lucky, good or bad, but I've been here for that like 7, 8 months now. And so basically, I was trained and educated here in Shanghai, and about 34, 35 years ago, I went to. Did I hear somebody mention about Arkansas? Actually, I went to Arkansas too. Uh, I went to graduate school in University of Arkansas in Little Rock back in '86, and where I got my PhD in molecular biology and biochemistry. And after that, I also I went to a residency training at the University Hospital there, and after that, I went to NIH for cancer fellowship. And long story short, that's where I finished my training, and then eventually also went to private practice. For the last about 20 years or so, um, I've been in clinical integrative medicine, and I heard about Dr. Levy as well. Dr. Levy is also my mentor in orthomolecular medicine, and a good friend of mine, I may claim. And I was so impressed by several of his books, and I translated them into Chinese, including one on vitamin C, primoprenation. I'm sure the group is very aware of that. Anyway, so when COVID-19 broke out, and because I know about vitamin C, so I started calling for vitamin C's usage, and with a group of other friends. I've been lecturing here in China for the last couple of years on vitamin C and other issues, and so that's how we got started. And a few other physicians here in China are also abreast of the knowledge on vitamin C. including, and I'm sure the group knows, including a Dr. Pan in Wuhan, the ground zero of COVID-19, and also Dr. Mao in Shanghai. And a couple of clinical trials had been registered and launched, and two of which have basically all these clinical COVID-19 vitamin C studies have been concluded because of the widening dying here in China of COVID pandemic, and the papers have been written, actually have been written for a while now, and they've been having trouble to getting them published. And one of the reasons for the rejection is the case numbers are not big enough. Well, let me just summarize briefly here is Dr. Pan's group in Wuhan, in their study, I think they had a total of 56 cases of severe and critically ill COVID-19 patients. And they were equally divided into two groups. One group receiving high dose vitamin C, and the other receives just a placebo. And the high dose vitamin C is 12 grams every 12 hours, so for a total of 24 grams. And the placebo, of course, just sterile water, plus your standard care, support care, and including low dose heparin if necessary. And so in this group, the some of the significant results were the significant reduction of 28-day by statistics mortality reduction. That was significant. And also the improvement in inflammation measured by IL-6 and the CRP, that's also significantly reduced. And those were the two major, and also the SOFA score, the organ failure measurement, that was also significantly improved. So those that's the preliminary, that's the result of the first group. The second group, Mao's group in Shanghai. The Shanghai patients are these are also severe and critically ill patients. But in the Dr. Pan's group in Wuhan, there was a randomized controlled trial, although scale was a little bit on the smaller scale, 56 patients only. The group in Shanghai, it was a retrospective case review studies. And so basically they screened their cases and qualified only 12 patients, 18 years of age and above. And they were again 6 severe cases and six critically ill patients. Well, again, it's even smaller. Originally, when the total cases were assessed, it was about 50, but only 12 qualified as severe and critical, and also 12 years of age above, and also not having like cancer or the other patients. So out of these 12 patients, they all improved very dramatically again by the measure of inflammation, and also by the measure of the requirement on mechanical ventilation. And mortality was not part of the measure because there was no mortality. In Shanghai, no deaths on HDIV patients. So those were two studies that have been concluded a few months ago, and one paper was submitted. They tried a couple of publications, and but most of them rejected it. And recently they've been submitted to critical care and also annals of palliative medicine, and I reviewed it for one of them. I don't know the fate. I highly recommend it. So So those are the papers, and along with the background review of vitamin C. Basically, both papers concluded that it is results show that the high dose vitamin C is very promising in reducing inflammation and may be able to reduce mortality and other clinical measurements, and therefore, of course, further study is warranted. And as I told Dr. Obuz earlier, before, vitamin C, we all know, including the recent trial of that citrus allele study, it also showed significant reduction of mortality, 28-day mortality, although that's a secondary measure. And tons of research have been done in the laboratory and the clinical studies that show vitamin C has antiviral capacity and is able to improve viral infections, including pneumonia, including particularly coronavirus, SARS and MERS, and also we know that exuberant oxidative stress or cytokine storm is a big part of the viral pathology. And so based on these, basically, vitamin C should be part of the clinical treatment along with other antioxidants. And recently, as I wrote a paper, a short op-ed for a major newspaper, and we don't know whether through some PR organizations. Basically, mainstream medicine and also mainstream journal news outlets refuse to report on vitamin C information, and like I wrote in the paper, vitamin C, there's plenty of evidence in the clinical and laboratory medicine in its capacity of being a virucidal. And also vitamin C plays a critical role in antioxidative stress. And oxidative stress, as I mentioned, is a major pathology in all these viral infections and COVID-19 as well. So even with evidence-based medicine, many doctors and lay people misinterpret evidence medicine, thinking evidence medicine is only well-designed, randomized control trial clinical studies. However, if we look at what constitutes evidence medicine, case studies, expert opinions, case series studies, these all are part of evidence medicine. Vitamin C, there's plenty of evidence for vitamin C to be used in COVID-19. So that constitutes evidence. And also vitamin C has no significant clinical side effects. This is well summarized in NIH-PDQ document. That's an official document, as the group is well aware. So even up to 1.5 gram of per kilogram of body weight, IV vitamin C is very safe. Therefore, there is no reason why not to use vitamin C. And thirdly, vitamin C is very inexpensive. So by just plain common sense, particularly with evidence in medicine, even FDA has a clause for compassionate use of drugs. Basically, any new drugs, even without approval, in case of there's no proven treatment, where COVID-19 is clearly for this kind of severe disease. There's no proven or generally accepted drug treatment yet. And vitamin C, here we have vitamin C with a long track record of research, very safe and effective in viral treatment, and very promising COVID-19. And then they rejected HD, high dose vitamin C. That is against the common sense, against the evidence-based medicine. And so basically, that's a short summary of vitamin C, and in COVID-19. So any questions? I can hear.
Dr. Chen, I know that we have a little surge here in United States. What's the status in China right now? Is there any surge where you are, or
Well, that's a good question. Actually, as you may have read, that there's been not really. There are some local surges in COVID cases. As you, this was about a month or 2 months ago. There was a so small area in Beijing, and so that Beijing area, is in a big market. The market, they found a new case of COVID-19, and so they quickly locked that area down, and they got under control, and later on it was reopened. Now that's not an issue in Beijing anymore, because at that time all residents in Beijing were restricted of traveling out of city, and the Beijing residents, if they would travel to Shanghai, they have to show a nucleic acid testing. Of course, that needs to be negative, and then they have to be uh, locked down in a hotel. And other than Beijing, now there's also research in Hong Kong. That seems to be a little bit severe. It's not under control yet. And also in a couple of other areas in China, in northeast Dalian, and that area is being, as far as I know, I think it's still probably locked down. And also there's a research in Xinjiang, that's down the northwestern part of China, near like Turkmenistan or that area. I heard there's also area of resurgence of COVID-19 cases there. Well, the rest of the country is okay, from what I hear, what I read, and Shanghai definitely is not a problem. Practically, the whole city is open now, and the whole city has been open since, I think, since late March or early April area, and at that time, the facilities were gradually opening up, and now even the movie theaters. I don't know anything that's locked down in Shanghai. It's the whole city is open, and they used to check the temperature when entering communities and things like that. They don't do that anymore. And of course, masks are still strictly required when you go on metro, subway, or other. You still have to wear masks. But some areas they still check your temperature, but it's not as strict as used to be. I want to comment here a little bit. That's not surprising. Actually, comparing the Spanish to the Spanish flu of 100 years ago, and this is a little bit concerning. I believe this kind of, not like in the United States, the lockdown policy, and I have some opinions on that. Now, we all know Spanish flu 100 years ago. It infected a great proportion. I know it's midnight here, so my memory may not be as clear. But I remember, the infection rate is probably more than 50% or close to that. It's a big portion of the world's population that were infected by the Spanish flu. Of course, the mortality was very significant at the time, or anywhere between 20 to 100 million. Remember, the world's population at that time was only, I think it was like 2 billion-ish. It's a smaller, much smaller, maybe 1/3 or 1/4 of today. So the point I'm making is that Spanish flu 100 years ago lasted 15 months, a little over a year, and was a greater proportion of a percentage of world population being infected, and presumably developed the immunity, so-called herd or population immunity. And today, from all the reports we read, because basically government mostly focuses on the testing, and all these testing results they come back, we hear, we read, is in the single digit. So very few areas. I mean, I haven't read anywhere like more than 10%, mostly in single digits. And now still there are no proved specific drug treatment for COVID-19. And no, except the Shanghai and Guangdong governments, they've been recommending vitamin C. And I know the population, the general public have been taking vitamin C because, as you witness everywhere, vitamin C has been, flying off shelf like crazy. And but no other governments have been recommending vitamin C that in the treatment, and vaccines are nowhere to see. And yes, they may have a vaccine coming out either next couple of months or most likely next year. But to inoculate the whole population, worldwide population, or big portion, or bigger proportion of worldwide population, it's going to take a couple of years. So, given all these, unfortunately, I'm a little bit pessimistic of how long COVID-19 will last. By just single the measure compared to COVID-19, especially Spanish flu 100 years ago, I'm afraid COVID-19 will last longer than Spanish flu. And so that's, I mean, again, going back to Dr. Obu's earlier question, the resurgence, you will see this everywhere in the world from time to time until this thing entirely goes away, because you can't lock down the whole world, because if COVID-19 doesn't kill us, the economy will kill us. So economy has to resume, and business has to resume, and otherwise, severe consequences. Like up to now, about 700 people basically have been died due to probably COVID-19, and also made more than 86 billion and trillion, 8.6 trillion economy loss has been suffered. So that's only like 7 months or 8 months, not even. So that's my comment on resurgence and COVID-19.
Thank you, Dr. Cheng.
Yeah.
This actually concludes our discussion on COVID-19. As you have clearly stated that with the gruesome outlook on vaccine and an ongoing infection, best thing to do is what Dr. Levy and then we have shared with our listeners, tapping into working things like the IV vitamin C, oral vitamin C, hydrogen peroxide treatments, nebulizer treatment with the colloidal silver, magnesium chloride, and vitamin D, and vitamin K2. So we all
don't forget zinc.
Zinc is the head of all of these. Yes, exactly. Again, I want to thank all of our panelists for joining, even though it's a Saturday afternoon, and then we will ask people to send us their questions even after this is aired on Task TV's internet site, and then we'll be happy to answer the questions and share the information we love to share with everyone.
Thank you.
Okay. Thank you.
Thank you.
Thank you.